Magnesium is a mineral that's so important for so many body processes. It plays a role in control of your blood pressure, blood sugar. It helps control your heart rhythm. It plays a major role in bone health and prevention of osteoporosis and fractures. But most people, virtually all people, start with magnesium deficiency, often profound magnesium deficiency. Why? Well, because we drink filtered water. The city can filter your water, or maybe you filter your own water in a home filtration system, and that removes virtually all magnesium, unlike the water you would have gotten by going to a river or stream that's flowing over rocks and minerals and is rich in magnesium. Filtered water has virtually no magnesium. We also eat produce like lettuce and spinach and other vegetables that have about half as much magnesium as they used to because of modern farming, modern agricultural practices. So we begin with profound magnesium deficiency. It gets worse if you've had a lot of diarrhea, say from chronic irritable bowel syndrome or ulcerative colitis or Crohn's disease or celiac disease or other causes of diarrhea, and that can lead to profound magnesium loss, even life-threatening magnesium loss. I've seen numerous cases of life-threatening magnesium depletion in people who've taken diuretics of any sort. They could be thiazide diuretics like chlorthalidone or hydrochlorothiazide, or the so-called loop diuretics like furosemide or torsemide. Those diuretics also lead to profound loss of magnesium, such that people are often experience sudden cardiac death or brought to the hospital with life-threatening rhythms, and they need to get immediate intravenous magnesium to stabilize their heart rhythm. So magnesium deficiency is common and worsened in these common situations. But can the opposite occur? Can you develop magnesium excess or magnesium toxicity? Well, you can. And we know what it looks like because there have been accidental overdoses in obstetric units where pregnant moms come in and they may be in eclampsia or preeclampsia and they're given intravenous magnesium. They're typically given doses of 2,000 milligrams, 3,000, 4,000 milligrams. But there have been accidental miscalculations, and some of these moms received doses more like 12,000 milligrams or 40,000 milligrams, and that can be fatal, because it leads to suppression of breathing, respiratory suppression, and fatal cardiac heart rhythms. And so we know that high doses, many-fold more than most of us are getting orally, can lead to fatal outcomes. We also know in people who have kidney disease, who don't clear magnesium like other people. So you recognize kidney disease typically by having a creatinine, it's a common blood test, of 1.3 or greater. That causes you to not have normal kidney function, part of which is retention of magnesium. And even by getting the average daily amount or the recommended daily amount of magnesium, you can still generate magnesium toxicity. So if you have an increased creatinine because you had repeated kidney stones, repeated bladder infections, had a kidney removed, or have some other form of kidney disease, you need to work with your doctor to track your serum or RBC, red blood cell magnesium levels, to make sure you don't become toxic, especially if you choose to take a magnesium supplement. The only other situation where you might see magnesium toxicity is in people who take huge amounts of magnesium-containing antacids, like Maalox or Mylanta. I can tell you that almost never happens. I've seen that once in my lifetime. That was in a woman with schizophrenia who, for unclear reasons, drank 6 bottles of antacid per day. I mean, it takes a huge amount over a prolonged period to do that. So in all practicality, if you have normal kidney function, just take a magnesium supplement restores a healthy level of magnesium. Now, I can tell you, if you're in a hurry to restore magnesium, let's say you have incapacitating migraine headaches, or a dangerous heart rhythm disorder, or substantial osteopenia or osteoporosis, thinning bones, and you want to get that magnesium up as fast as possible, it really pays to take a highly absorbed form, such as magnesium bicarbonate. You make magnesium bicarbonate with my recipe for magnesium water. You can find that recipe in all my Wheat Belly books, in my Undoctored book, in my Wheat Belly blog, in my Undoctored blog. Just about everywhere I've been, I've left a recipe for magnesium water. And all it is you're reacting the magnesium hydroxide of milk of magnesia, unflavored, must be unflavored, milk of magnesia, with seltzer water or some other carbonated beverage. And you react them, follow the instructions, and you obtain water plus magnesium bicarbonate. It's virtually tasteless, and follow the dose instructions in all those places where I wrote the recipe down. And that provides magnesium bicarbonate, which by far is the most highly absorbable form of magnesium. I had people who had a form of rare kidney disease over the years who had, rather than magnesium retention, had the opposite, magnesium loss through their kidneys, called the magnesium-losing nephropathy. And these poor people would be dead within 5 to 7 days if they did not get intravenous magnesium. So you can imagine, very scary, very incapacitating. You had to always go back to the acute care or ER, get an IV put in, and get a big dose of magnesium. Had to come back in a few days, and if you didn't, you'd have sudden cardiac death at home. So very scary, very incapacitating for people, emotionally crippling. Well, I wanted a way to keep these people to not have to go back all the time for intravenous magnesium. I tried every form of magnesium, tablets and capsules. None worked. None raised levels within that time period, 5 to 7 days. So I made this recipe for magnesium bicarbonate, magnesium water, and it was the only thing that kept their blood levels of magnesium up. It still did drop over the course of 5 to 7 days, but it was enough that we could just use magnesium water to keep their magnesium up. They did not have to go back to the ER to get an infusion of magnesium. So I know from experience that the magnesium water is by far the most rapid and potent way to get your magnesium. So heart rhythm disorder, osteoporosis, or some other reason you want to get your magnesium up rapidly, magnesium water is your choice. Otherwise, use well-absorbed forms like magnesium malate, magnesium glycinate, magnesium chelate. Those are good forms because they're fairly well absorbed, but even with those tablet or capsule forms, it takes about 2 years to get your tissue levels up. So you can imagine magnesium bicarbonate from magnesium water raising your level within days to weeks is a much more effective way to get your magnesium. But all in all, it's very difficult if you have normal kidney function to have magnesium toxicity, so it's really not a practical concern for most of us. Now, if you want to know how magnesium fits into an overall program for health, because you want to get off blood pressure medicines, because you want to no longer be a type 2 diabetic, because you want to do everything possible to reverse bone thinning, because you want to get rid of your ulcerative colitis, Crohn's disease, irritable bowel syndrome, rosacea, seborrheic, eczema, minimize joint pain and swelling, etc. All these kinds of magnificent health effects that I deliver through all my programs. I've just released a new book called the Wheat Belly Revised and Expanded Edition. And there I condensed all the information in all my books, all the lessons we've learned over the last 8-9 years, and present it as a program you can follow. That includes magnesium, how to use it, how to dose it, as well as all the other components of the program, with the goal here being a restoration of magnificent health for you, prevention or reversal of numerous health conditions, and weight loss, if that's among your goals.